All right, let's get right into it. Today, we're diving into a really fantastic explainer of Krishna Sudhir's TED Ed lesson on a topic that is literally a matter of life and death, the life cycle of a heart attack. We're going to break down the whole shebang, from the invisible biological forces ticking away in the background to the actual acute event, and finally, how modern medicine fights back. So, get comfortable, and let's unravel the science behind one of the human body's most critical events.
Okay, let's dive into this with a number. 7 million. It kind of takes a second to truly process the scale of that, right? Roughly 7 million people around the world die from heart attacks every single year. It's a staggering, almost incomprehensible statistic when you first hear it. I mean, that's a massive, worldwide health reality touching pretty much every community on the planet. This isn't just an isolated issue, it's a global phenomenon. And understanding exactly why this massive number exists is the exact reason we're breaking down this explainer today.
So, the root of the problem isn't actually just the heart attack itself. The real culprit is cardiovascular disease. Basically, this is a condition where fatty deposits, mostly cholesterol, slowly build up in the walls of your body's arteries over decades. It officially holds the heavy title of the world's leading killer. It's the foundational threat, you know? A heart attack doesn't just happen out of nowhere, it's the direct result of these narrowed, hardened arteries. And this disease is responsible for not just heart attacks, but other incredibly severe emergencies like strokes too. Really, when we talk about a heart attack, we're actually talking about the acute, explosive climax of cardiovascular disease.
So, if cardiovascular disease is the overarching umbrella, what specifically triggers the heart attack itself? Let's zoom in on that microscopic biological chain of events.
Let's move to and see how this builds. Step 1. Cardiovascular disease develops. This is the silent phase, atherosclerosis, where those fatty plaques just kind of grow inside the artery walls, totally under the radar with no immediate warning signs. Then, step 2. The disease triggers underlying causes. This is where things get volatile. The fibrous cap of that fatty plaque actually tears or ruptures, and your body responds to this rupture exactly like it would to a paper cut on your finger. It rushes platelets over to form a clot. Finally, step 3. The acute heart attack hits. That blood clot grows so large that it completely blocks blood flow through the coronary artery. Without blood, a section of the heart muscle is instantly starved of oxygen. And if that deprivation lasts for more than just a few minutes, the heart tissue actually begins to die. It's a powerful reminder that this isn't some random accident. It's a very defined progressive biological cascade.
But hey, knowing the biology is one thing. In the real world, how do you actually know someone is having a heart attack right in front of you? Recognizing it in real time is where this science becomes a literal survival skill.
Recognizing the acute event and identifying the telltale signs as they're happening is absolutely crucial. Probably the most important moment in this whole life cycle, because once that artery is blocked, the clock is ticking, and loudly. The body starts sending out these desperate warning signals. Now, the most common one is a crushing chest pressure or pain, but because the nerves in the heart share pathways with other parts of the body, the brain often misinterprets where the pain is coming from. That's exactly why people get pain radiating down their left arm, up into their jaw, or across their back. Other huge red flags include severe shortness of breath, cold sweats, and profound nausea. Oh, and here's a super vital, sometimes surprising fact. Symptoms can look very different in women. While men often get that classic elephant on the chest feeling, women are way more likely to experience extreme unexplained fatigue, indigestion-like pain, or jaw pain. Spotting these signs isn't just medical trivia, guys. It's literally the bridge between a fatal event and survival.
So, once those signs are recognized and the acute event is underway, how do we fight back? Let's take a look at how modern medicine steps into the ring.
This explainer really dives into the incredibly sophisticated interventions we have today. Once a heart attack is identified, the absolute immediate goal is to restore blood flow to that starving heart muscle. First responders might use clot-busting medications, thrombolytics, to basically dissolve the blockage right then and there. In a hospital setting, doctors often do an angioplasty. This is wild. They literally thread a tiny catheter up to the heart and inflate a microscopic balloon directly inside the blocked artery to push the plaque back. Usually they follow this up by leaving behind a stent, which is like a tiny wire mesh tube just to keep the artery permanently propped open. For the really severe blockages, surgeons might even perform a bypass. That's where they take a healthy blood vessel from another part of the body to literally route blood around the blockage. From those high-stakes emergency procedures to long-term management with blood thinners and cholesterol meds, knowing these treatments exist really gives us the full picture. We don't just know how this disease attacks us, we know exactly how to aggressively fight back.
Ultimately, getting a grip on these invisible causes and the visible warning signs is our first and honestly our best step in combating the world's leading killer. Just think about that. Those 7 million deaths we talked about at the very beginning? The best weapon we have against that staggering number is exactly what you're doing right now: learning. By just understanding that a heart attack is a ruptured plaque causing oxygen starvation, and crucially, knowing that something like sudden jaw pain can be a major alarm bell, you're empowering yourself. You aren't just absorbing some interesting science today, you're equipping yourself with actionable knowledge that could, quite literally, save a life down the line. It really makes you wonder, who in your life might benefit from you having this knowledge today? Well, thank you so much for joining me for this explainer. Keep learning, stay curious, and I'll see you on the next one.